Well, I'm Sam Spencer and I'm the Senior Sports Facilitator at Caboolture. So I work at Open Minds. And started about a year ago out at Caboolture. Didn't know the area, had been working up the Sunshine Coast and happened to get a job nearer home, which was great, until I started and realised that Caboolture has this huge area to cover, right out past Kilcoy and Jimna and It was huge, BUR, almost to BUR, Bribey Island, and our services seem to be very few and far between. So we started out, our vision, we were a different team then, so we lost, I think Penny spoke this morning, so Penny was part of the original support facilitator team, and her background is community development, so I was very lucky to have her on part of the journey. So we started looking at the whole area and the gaps, because there were many gaps. And what we didn't want to do was come in on this white horse and be, hey, PiR are here, we're going to save the world and we're going to do this and that. We had 3 years, and we knew that we had 3 years to go in and do something sustainable. We didn't want to go in and tell people how to do it. We didn't want to go in and do something and then be gone and there's nothing left. We wanted to collaborate, we wanted to work with other organisations that were already in the local area that had been doing it for far longer than we were and would hopefully be around doing it when we were gone. And we wanted to try and, use people with lived experience and use their voice and use their skills and use their knowledge and the local community and really build on that. So we really started to look at the Kilcoy area in particular as somewhere that got very few services. I remember getting a call from one of the sports facilitators that was doing the 1-800 number one Friday afternoon, and she said, I've got a guy in Kilcoy and he's homeless and he's got alcohol and drug problems and he's about to lose his accommodation tonight. I don't know the services out there, what can I tell him? And I said, well, there aren't really any services out there that can deal with that, unfortunately. And she said, but he's threatening suicide, and she was anxious. She'd been talking to his family, and his family were really anxious about this guy. And I'm like, oh, I can ring the hospital and see if they can do anything for him. But I'm really, if he, there's pretty much nothing out there for him. He would have to get into Caboolture. Maybe CCA can offer him some support over the weekend. So I rang the hospital and they basically said exactly what I just said. There's absolutely nothing out here for this gentleman. If he can catch the bus to Caboolture, then maybe he can get some sort of, something quick for over the weekend, and we'll see what we can do after then. But yeah, there's really nothing. So we had to ring this family back and inform them that there was actually absolutely nothing. Even the hospital had said, if he's intoxicated or he presents being aggressive, we lock the door and we just call the police, because we don't have the staff to deal with that. So that was quite early on in our beginnings, and so we really did recognise, that there's a huge need out there, and services that were on the ground in Caboolture, even though they were funded supposedly to service out there, it's such a big area that they weren't really able to provide those services out there. It was just too far. They didn't have the numbers. So we started to think, okay, so what can we do? What would be helpful? So with Penny's community development background, we started to go out there and meet with local groups, there's a network out there that a lot of people, they're just volunteers, the people that are really interested in supporting their own community on lots of different things. So we started with some consultation. And what we found, which amazed me, it blew me away, there were 80 local community groups out there that, they were just doing it. They were supporting themselves, they were involved, it was just phenomenal. I've never heard anything like it, to be quite honest. So many people just out there doing it, because no one was doing it for them. They were having to do it for themselves. And then about the same time, we got a referral. So Open Minds is also has PiR in Westmorton and Oxley, and we dovetail with them on that Esk kind of Somerset region. And we received a referral, and they also received a referral for the same person at the same time. And basically what happened was this lady had been she'd been unwell for quite some time, but the local community between them had just been really caring for this lady and looking after her and looking out for her. But over time she'd become more and more unwell, and they became concerned that they weren't doing the right thing. They weren't really sure how to support her anymore. So one person referred to PiR in North Brisbane, and another one to Westmorton and Oxley, and it just happened that we had that conversation about this person. You know, so that struck us again, like the community is actually already doing this stuff. They're looking after each other and their own and doing the best they can, and they're only really asking for help when they get stuck, you know. So that was part of what we wanted to do. We wanted to go out, see what was there, and then see how we can leave something behind, really, when PiR disappears. The other part of that was that we wanted to use those local organisations. So Kabams at the time were also thinking about how can they go and provide some sort of therapeutic kind of groups stuff out at Kilcoy, but they didn't have the capacity. So we came up with, could we collaborate with them and enable some stuff to start going on out there? Kabams they were providing the support services in Caboolture, so we just wanted to build on that. And they were already providing RAP groups. Kelly's going to talk to you about RAP if you don't know what RAP is, but RAP's Wellness, Recovery and Action Planning. So they were already doing that, so we thought, can we take that out to the Kilcoy and Bribie area? And because PiR essentially is not a service provider, we would use flexible funds to purchase that from Kabams, and they would go out and deliver. So we came up with the idea. It does change. There is a drama to this, of course. We came up with the idea that Kabams already had one trained facilitator. So because we wanted to also look at enabling people with a lived experience to start to help their own community and things, we looked at training some consumers at Kabams who had been through RAP a few times themselves and were ready to start getting involved in the local community. We used flexible funds to train as peers, people that had been through the experience themselves, along with their person that was already trained, and a supports facilitator. And then the whole idea was that we would provide 2 RAP groups originally at the beginning, one in Kilcoy, one in Bribie, but one and employ the people that would been through the process. So they getting my words muddled up at the moment. Hang on. So the PiR workers would then become employed, I guess, on a casual basis to deliver the groups. So, and then also what that meant was then there was a growing network, because there's already a RAP facilitators network in North Brisbane which is not connected to any one agency. So that meant we were adding to that group, and when PiR goes, this group's there, it's self-sustaining, it's not tied to any one bucket of money or any one organisation, so it could go on and grow. Okay, so why RAP? Just those things that I've just been saying. It's evidence-based. We already had people that were trained in it. We already had people that were interested in delivering it. And this network that's going in North Brisbane at the moment, it's self-sustaining, it's supportive of its own trained facilitators. It just meant that, the day we step back, it's all there, it's ready to go. And the bigger vision was that this would be the plan for this year, but then hopefully next year we'd also be able to grow on that, and that could continue to extend in Kilcoy, so there'd be more trained facilitators, and also in Bribie more trained facilitators, so it could just continue to grow. Okay, this is where it gets a little bit chaotic, as life seems to do. So how it started, in June 2014, we trained 2 of the Kabams volunteers and 1 PiR SF to deliver or facilitate the RAP training. And then we'd done this beautiful tender of pooling funds to use PiR funds to deliver the group, all with Kabams and all this collaboration. And then it was literally on the Friday that I'm finishing this beautiful document that we'd spent hours putting together, and we got the call to say that Kabams had lost funding. So it was like, oh, what are we going to do? That just throws everything out. We've done all this work, and we've got these volunteers that were already trained and really keen, and our already trained facilitator belonged to Kabams, and so how would that look? So it was a little uncertain for quite some time. And then in August, Where are we? Yep. So, yep, and then in August, our trained facilitator, our SF that we'd paid to train, also left. So we ended up with, we pretty much were back to square one. In terms of, the idea was still there, and the will was still there, but we were kind of in limbo with what we would do. But it's still important to us. It's still something that we want to push forward. So we kind of thought, oh well, you just got to deal with these things. So we've sent another one of our. We got a new team member, Kelly, and she went off and did the training, thankfully. And we're still really not sure whether we can actually use the volunteers that we had that trained, because now they're not employed. One's gone off and got a full-time job, so we're not sure whether she has the capacity to do it. The other one, it's a case of if we can get someone to employ him so that we can then use him on a casual basis, but that's just something we've got to kind of explore a little bit at the moment, so that's not really certain. But where we're at now is that we're ready to go. The flyers are out, the groups are booked. We've got 2 weeks, I think, 2 weeks till the end of October, and then we're hitting the ground. So we've got a group at Brisbane and a group at Kilcoy to go, which will run until just before Christmas, and then we'll see where we're at for next year. But the plan would be that next year we'll train some more people so that can continue to go on. So I'm just going to hand over to Kelly, who's just going to give you a bit of an update, an idea about what RAP really is.
Far too tall for me. Hi everyone, I'm Kelly, as Sam said. I'm a support facilitator also with Open Minds out at Caboolture. So as Sam said, I recently completed the RAP training, so I just wanted to let everybody know a little bit about what RAP is and what it does and why we think it's so important a tool to for people who are living with an experience of mental illness. So RAP was developed by Mary Ellen Copeland in the late 1990s, and she was somebody herself with a lived experience. She'd spent time in hospital and had been in and out of kind of hospitalisations and had been put on medication. So she'd managed pretty well on the medication for a period of 10 years until she developed a toxicity to lithium, and she was taken off that medication. She was spending time with her psychiatrists, trying to get more information around how she could either medicate herself or continue to remain well and be able to live her life. And this psychiatrist she was seeing promised that he would find some information for her about how she could continue with her recovery. And she went back to see him, very excited to find out what it was she could do for herself, and she was told nothing. There is nothing that we can do. There are no other answers. And she didn't really want to accept that, so she decided to survey, basically, lots of different people who had come into contact with the mental health system. This was in the US, by the way, not in Australia. Lots of people who come into contact with the mental health system who had their own experiences in mental health, and find out what it was that they were doing that kept themselves well. And she got a huge response, all kinds of information from people giving her ideas and examples of what they do to maintain their wellness, which she was quite excited by. So she was like, okay, here I am being told I can't recover, but actually there are heaps of people out there who are working on their recovery. So with all that information she compiled, she came to realise that there were 5 key concepts to recovery, and that they were hope, personal responsibility, education, self-advocacy and support. And that's what RAP is based around, those 5 key concepts. So the RAP groups and what the RAP groups will be running in Brisbane and Kilcoy will run for 2 hours a week for a period of 8 weeks. The really important thing about RAP is, although it's facilitated by trained facilitators, people who have been trained to deliver RAP in Mary Ellen's model, how she wrote it, although they will kind of guide, I guess, and lead the sessions, and they are quite structured, the idea or the success of RAP comes from the fact that it's really led and directed by the peers that are involved in the group. It depends upon their involvement. It depends upon them sharing their experiences and ideas of what keeps them well, and how they've developed their own kind of hope and personal responsibility and those kinds of things. So yeah, that's really important. I was going to share with you just a little idea of how the groups might run. I was going to ask you to give me some feedback, but I think we're probably short on time, so you're off the hook. But basically, the sessions, the way that the sessions try and run is that there's sort of 25% the facilitator, so me, giving a bit of an overview about that module, that aspect of the programme that is under discussion on that day. 25% would perhaps be me sharing what I do to keep myself well, and I think it's important to recognise that doesn't have to be me kind of sitting there going, oh my God, everything's been terrible in my life. But more, if I run once a week, I feel more energised and I'm more motivated, and things like that. And then 50% is feedback from the people in the group. So really getting people to talk about what their experiences are. So the first session would very much be, what does hope mean to you guys? How have you experienced hope or lack of hope in your lives to date? And how have you learned to take responsibility, personal responsibility for your recovery and for your well-being? And I guess that's a real key, and one of the reasons we want to deliver this kind of a training, because it does focus on recovery. It does focus on what people can do for themselves, rather than kind of that medical model where people might have had that experience in the past of being told what they should do or what they need to do in order to make themselves well. So over the 8-week programme, by going in this kind of formatted, structured way, people will develop their own RAP. And RAP really is a tangible document that is very individualised, very personalised. You don't have to show it to the facilitators. There's no homework or right or wrong or anything like that. And at the end, they will have a document, a living, working document that they can add to at any time, that helps them to stay well. So what does that RAP look like? It's made up of 7 parts. The first part is called the Wellness Toolbox, and that is a list of all those things, like I just mentioned. For me, would be running once a week or talking to a friend. So it can be anything. It doesn't have to be complex. The beauty of this is that it's a really simple tool that anybody and everybody can use and implement on a day-to-day basis. The second part is daily maintenance, so kind of getting yourself on a bit of a program, a bit of a plan on what you might need to do in your week to keep yourself well. And then they move into triggers, so what kind of things might happen that might make you come unstuck or might make you experience symptoms of your mental illness. The early warning signs to that, so how can you or other people notice when things might start to be going wrong. The fifth area is when things really are breaking down and the action plan around that, so when things are moving towards crisis, but before a crisis hits, so we're still trying to avoid that kind of a crisis situation. The sixth part is crisis planning, and although that probably sounds a bit negative, that's really valuable because it gives the person an opportunity to say, if I'm in crisis, this is what I want to happen and this is when I would like somebody else to intervene. So it kind of maintains that level of taking responsibility for their well-being. And the post-crisis plan, which is about if you've had a hospitalisation, you're coming out of hospital, about building things back up so you can get back to using your wellness toolbox and developing or going back to your daily maintenance plan. So that's it really. So as Sam said, we're going to be running we're going to be running an information session actually on Brisbane on the 22nd in the afternoon at the neighbourhood centre, and in Kilcoy on the 28th again in the afternoon at the Kilcoy Wellbeing Information Service. So if anyone knows anyone they want to send, shameless plug, let me know. My details are on the list that we got given this morning. So yeah, let me know. And I'll pass you back to Sam.
Okay, so thank you. All right, so the challenges that we faced so far. So the big one that really did throw a spanner in the works was Cabam's losing funding. And then we lost our trained facilitator. The other difficulties really are the geographical locations. It's, Kilcoy especially is just so widespread. And so even if we manage to pull this off and we get the groups going, and it'll be difficult for some people to get there on a weekly basis. So yeah, that's we're just going to have to see how that goes. the lack of mental health services in the area. So again, we're already thinking, are we going to get enough people to make this work? We're going to do it no matter how many people turn up. But to be able to have evidence to support the fact that we want to continue to run it, we've got to try and get referrals from somewhere. Our time workload, we are really busy, and the fact that we are delivering services on a huge geographical means we spend a lot of time in cars too. So that's always an issue around trying to separate the direct client work and doing these bigger projects. People not always knowing what RAP is, so especially because out in Kilcoy, and I'm talking Kilcoy because we found that's where the bigger gap is, and that's where we've concentrated on this year. And Bribie will look at a bit more in depth when we get Kilcoy more established. But yeah, just getting people to just talk about it and to know what it is and be prepared to say, hey, why don't you go along? This might be really good for you. And stigma, because that's the other thing that we've realised. Out in these small communities, stigma still does exist, and it exists more out there than it does maybe in the more urban areas. So it's going to be about I think we have to be really mindful around how we promote this. It's not about mental illness, it's about staying well. Mm-hmm. So it's just being a little bit sort of mindful about how we go about that, really. And that's it.